Welcome to the video on acceptable intake limits for nitrosamine impurities. So in this video we are going to learn about the acceptable intakes for some of the nitrosamine impurities and also for the NDSRI impurities. And this video will give you the brief introduction how the intake limits are provided for the nitrosamine impurities. AI limits, these are very crucial and very important for the nitrosamines and mutagenic type of impurities so that the drug safety is ensured over a lifetime. And these AI limits are defined in the main guideline of ICH, that is ICH M7 guideline for mutagenic impurities to minimize the risk of cancer in the patients. The target for mutagenic impurities or nitrosamine impurities is approx one additional cancer case in 1 lakh individuals or 1 in 1 lakh species, and the AI limit assumes daily exposure of the impurity over a lifespan of 70 years using the conservative estimates. FDA guideline is also there on the nitrosamine impurities, which provide information on the AI limits, and it includes limits for small nitrosamine impurities and also for the nitrosamine drug substance related impurities. Those are also called as NDSRIs. So these limits serves as a benchmark for control strategies in APIs and also in the drug products or the drug formulations. Whenever you are dealing with the multiple nitrosamine, that time the one thing is to understand here is that the total exposure should not exceed the AI limit of the most potent compound, and in simple words, it means the risk of cancer, that is 1 in 1 lakh species, should not exceed compared to the most potent compound. It allows alternative approaches if the AI limits differ significantly. AI limits typically measured in nanograms per day, that is ng per day, and it is converted to ppm level considering the maximum daily dose. So conversion to parts per million ppm based on drug's maximum daily dose. Default AI limit, for example 26.5 nanogram per day if specific data is unavailable, and it differs from regulatory body to regulatory body, or you can say country to country. The default acceptable intake limit, that is AI limit for nitrosamine impurities, varies by country and nitrosamine. So as per EMA, it is 18 nanogram per day. The default limit for structural group 2, 6 and 8 is 18 nanogram per day. As per US FDA, the recommended AI limit for NDEA is 26.5 nanogram per day. As per TGA, the default class specific threshold of toxicological concern, that is TTC, is 18 nanogram per day. And the AI for nitrosamine can vary depending on the nitrosamine and the country. Also, it is based on to the toxicological data available till date. For example, the limit of NDMA is 96 nanogram per day. And how these limits are calculated or AI limits are given, those you can find in the video on this channel, so that you will understand how the AI limits are calculated considering the LD50 data and extrapolation of the carcinogenic risk. Carcinogenic potency data or carcinogenic potency categorization approach, that is CPCA approach, is used for determining the AI limit when there is no robust data available. So some methods are there for determining the AI limits like CPCA. Then another is estimation based on the available information or read across analysis from the similar compounds. These similar compounds are also called as surrogate compounds or surrogate impurities. Guidance and validated analytical methods available from the FDA resources like RAIL guidance. So recommended acceptable intake limit guidance is there for nitrosamines by the US FDA. Those guidances you can refer. Then what are the challenges in setting AI limits for NDSRIs? So the challenge is that NDSRIs often lack mutagenicity or carcinogenicity data because NDSRI have the structural similarity with the API, and that's why many times these NDSRI lack mutagenicity or carcinogenicity data. Another challenge is requires a scientifically justified approaches to determine the AI limits. Manufacturers are advised to consult FDA guidance and compliance. Many of the times the applicants are also advised to consult the specific regulatory bodies for setting the AI limits for NDSRIs. So this is the guide. This is the short video on acceptable intake limits for nitrosamine impurities. Mainly the nitrosamine impurities are small nitrosamine impurities and the NDSRIs. So toxicity data is used for determining the AI limit. LD50 data is there. Then CPC approach is there. Then surrogate compound data is there. And sometimes the regulatory bodies are required to be communicated for the finalization of AI limits. So I hope this short video will give you good information about the AI limits for nitrosamine impurities. Thank you for watching the video, and please do like, share and subscribe to this video.